seasonal affective disorder might affect many people and families. And joining us this morning to talk about it is the clinical psychologist, Dr. Judith Zackson, talking about the coping skills and what it is. Good morning. Thank you so much for being here.
Thank you for having me back.
So, what are the summer blues?
Yeah. There's a difference between sadness and seasonal affective disorder. Summer blues is you feel sad. We all feel sad sometimes, but with seasonal affective disorder, it occurs every summer.
Why is it common in the summertime as well?
Right, because some people, the sun doesn't do well for them. The heat and the summertime, and it impacts their sleep. It's also nature and nurture. Some people have a family history of it. And with the environment, you know, it's very stressful summertime. It can be a financial stressors. Some people feel like they have to vacation and travel and they can't afford it. There's also a very big change in schedules. When we go to work, go to school, we don't have to think, but when our schedule is off, we're kind of thinking and stuck with all of our thoughts.
Makes sense. So what are the symptoms?
The symptoms are feeling sad, irritable, you want to isolate, you feel sluggish, your whole body moves differently, your sleep cycle, your eating, and then in extreme cases, you also have suicidal thoughts and ideations.
Oh, that's very scary. So what are the causes?
Sometimes when you've had trauma in the past, in the summer, and then summertime comes, all those memories come right back at you and you become sad again. So it's very important to create positive memories.
And is that one of the steps to help cope?
That is one of the steps to help cope, and educate yourself about it. Second, I would say cognition is thoughts. Think about that. Depression doesn't let you think realistically. It's all negative. Last, I would also say is get out there and do things. Mingle. Do the opposite of what depression tells you to do.
Good advice. How can family and friends help too?
Family and friends have a very difficult time because they feel helpless when they see their loved one suffering. So you have to be very careful from enabling versus helping. Try to ask them how you can be of help. Try not to put pressure on them. Remind them that this too shall pass. Help them get onto their schedule. If they can, then help them seek out professional help.